And we're live. What's up, everybody? I'm here with Claire Bowe from Rose Physical Therapy fame. She's the owner and physical therapist, founder physical therapist at Rose Physical Therapy, which is Old City CrossFit's go-to physical therapy clinic in Washington, D.C. Anyway, what's up, Claire? How's it going?
It's going well. Thanks for having me.
Yeah.
So what would you like to talk about today?
Yeah, ultimately, so we're hosting a pelvic floor workshop, or you guys are hosting the workshop at our gym.
Yep.
And I want to ultimately get into pelvic floor issues and just kind of have a conversation around the pelvic floor. But before that, just kind of maybe a little bit of background about yourself, how
Sure.
Rose Physical Therapy started, how you got into physical therapy, and just kind of let people get to know you for a second.
Yeah. Let's see. I've been a physical therapist for a number of years now. This is actually my third career, so I had some other things leading up to this.
Wow, I didn't know that. What were the first two?
I went to graduate school for occupational therapy.
Okay.
And did everything except the internship, so I actually never graduated, but I did all the coursework. And then I went and got a degree in special education. So I actually have dual credentialed in special ed for special needs kids under the age of 6, which is early intervention. And in special ed lingo is EI.
Yeah.
And then also kids who are blind and visually impaired. So at some point I knew how to read Braille, but it's been a while.
That's awesome. So what was the transition into physical therapy? What started it? And,
So I really wanted to finish the OT degree, and I looked at a bunch of different schools. I thought it was a school that I was at that was problematic, and so I moved actually from Washington State, where I'd been in school, and I moved all the way to Chicago to go to OT school, and then I realized very quickly that it was actually a profession that was not right for me.
Really?
And so I in the school that I was at, we were mixed. Some of our core classes, like anatomy and physiology, and a couple others were mixed with physical therapists, and I found myself more attracted to not only the courses that they were taking, but also like all my friends were the PT students, not the OT students. So I went to the head of the PT department and I said, I think I was supposed to be a physical therapist. I just didn't know until like a week ago. And he was like, well, you know, our prereqs are different. I'm like, I've got a master's degree and I've got all this other stuff. I'm pretty sure I've got the prereqs. And he was like, well, yeah, you probably do. Okay. So he said, we'll just start going to the PT courses and we'll just take care of the paperwork.
Wow. That's
and
awesome.
So that was that. And I never looked back.
Yeah. And so you became a physical therapist.
Yep. And I practiced in a bunch of different settings. So I've been working in healthcare for 23 plus years.
Wow.
And I started as a nurse's aide in a nursing home when I was 16.
Okay.
And I've worked in home healthcare, and I worked with kids and schools, and yeah, you name it. And then just worked my way through undergrad, and then even as a physical therapist, I am somebody who likes variety. So I've worked in all kinds of different settings, even just for short periods of time: nursing homes, hospitals, schools, children's hospitals, inpatient, outpatient, stroke people, you know, all kinds.
Wow.
And I was never the person who said, I want to work with athletes. Like, that never even occurred to me.
Right.
And being an active person myself, but not somebody who considers themselves an athlete,
Yeah.
that was not something that was present for me. And then my spouse is an athlete, and
Right.
he was like, you really need to work with athletes. Like, you're so good at this. And I was like, but I don't really know what I'm talking about. and you know, one thing led to another, and I started taking courses and started really understanding. And now our specialty here at Rose PT is the high level athlete, because there are basic things like and a lot of PT clinics are geared towards post-surgical people, because there's a lot of people out there having surgeries, and and then those people need rehab afterwards. But our specialty is people who haven't had surgery and are having issues, and our goal is to prevent surgery.
Yeah.
And so that sort of the people who are in that boat are kind of the working age adults who like to stay active, and so that's really our specialty here. And then the way to that is is being really good at anatomy and really good at manual work and knowing how to fit everything together in the jigsaw puzzle that is the body.
Yeah.
And I feel like my start as a physical therapist started with me sort of doing my own mechanics on my vehicles. Like I always worked on my own vehicles, and I rebuilt a motorcycle and like all this stuff. But really, like that's all we are as physical therapists. We're like mechanics for the body.
Interesting.
It's understanding how it all fits together and how it's all supposed to work, and then assessing somebody's body and saying, oh, this part isn't working, and we need to get it working in unison with everything else, because just like an engine, everything has to be working in unison and properly in order for the whole thing to function.
Wow. Yeah, that's awesome. I think one of the things that initially drew me to Rose Physical Therapy, when, because I was looking for a place to get physical therapy when I was, I guess I still am working out, I guess from time to time, but one of the cool things about you guys is that your mission is to get us back into doing the things that we want to do. And very early on in my CrossFit life, I started doing CrossFit. I had back surgery when I was in my early 20s, and I started CrossFit and my knees started hurting and my back started hurting, and then I would go to physical therapists, a lot more of these, very traditional types, and they would be like, oh, well, stop lifting weights.
Yeah.
And I'm like, I'm 28.
Yeah.
What do you mean stop lifting weights?
Yeah.
Like, is this my life now? I'm not allowed to pick things up anymore?
Yeah.
And like, I don't want you to tell me how to not make it hurt. Of course, like sitting on the couch and doing nothing is gonna not make it hurt. I want you to tell me how to not make it hurt and still do the things I want to do.
Right.
And so when I found you guys, it was really cool, because it was like, all right, what hurts? Here's like, we're gonna teach you how to make your body stronger and better so that you can get back into CrossFit, so that you can get back and do the things in life that you really want to do, and not like, you're not in the business of closing doors of people's lives. You're in the business of opening the doors, and I think that's really cool.
Well, thank you. Thanks for noticing.
That's awesome. And the other thing I noticed that's really cool, and I don't know if this is a lot of physical therapy places. I haven't been to very many, but the few that I've been to were really busy, and a therapist is working with, there's some overlap, and it kind of makes sense, because I don't need somebody to watch me while I foam roll for 5 minutes. And but I was blown away by the whole hour is spent with the therapist.
Yeah.
And there's so much personal attention at this clinic. It literally blew me away, and I was like, what? Like I wasn't expecting that. So I'd imagine that's very intentional.
It is. Our goal is to spend the time in therapy with the things that you can't do on your own.
Yeah.
And so that the 5 minutes of foam rolling, you can do that on your own. We don't need to watch you unless we're teaching you something. Mm-hmm. Like that's not something that is a valuable use of your time in treatment.
Right.
And that allows us to really focus on the things that you can't do at home, or training how to do those things, or correcting, or whatever it is. So that it is very intentional. And then the other thing that does is it typically decreases the number of visits that you need.
Right.
So the goal would be, not 3 times a week like maybe your prescription says, but let's do once a week, because you can do all the other stuff on your own, and then you just come for the things that you need for.
You kind of show up for the manual sessions, and then get taught how to do the exercises, what exercises to do, and then since I would imagine that since you're working with a more motivated client, right? The person who wants to get back to their sport, or the person who is still doing their sport but has some pain, which is really ultimately telling somebody to stop doing whatever their activity is like a last resort. Right.
That would be like a really okay, I actually don't know what else to do here. Kind of last resort. So the goal is to keep people doing what they're doing and resolve whatever the issue is.
Yeah. But I would imagine you're working with a much higher motivated client who's, most of them, probably, I think the hardest part about what you guys do is the fact that when people go home, how many people are really compliant with 100% of their exercises,
I'm impressed. I'm impressed with people here.
Yeah, I think that's cool, but I think it's a testament to kind of the system that you've set up, and it's built with the expectation, like, we're not going to waste your time but don't waste our time. Like come in, haven't done the exercises.
Right.
And maybe it's not that blunt.
No, sometimes it is. And sometimes people are like, look, I just legitimately don't have time. So there's two solutions. We can either say, well, let's just hold off until you're really ready to do this. Or there are some people that say, you know what, I actually am not going to do my homework unless I come in, so I'm going to book 3 times a week so that I can be accountable.
Yeah.
That's fine.
Yeah. That makes a lot of sense. Cool. So you have a location in Northwest, and then you just opened the location we're in right now, which is are we in Southeast?
We are in Southeast.
Southeast.
Yeah.
Cool.
Officially, it is the Capitol Riverfront.
Okay.
That is the official name of the neighborhood here, although everyone pretty much calls it Navy Yard.
Navy Yard. I didn't know it was called Capitol
Riverfront.
Yeah.
Yeah.
Well, in the heart of the Navy Yard.
Yes.
And it's a beautiful place.
Yeah, thank you. Our other location is downtown, and this is the second location is a new venture. It's good.
Yeah.
It's a growing neighborhood.
That's awesome. So, pelvic floor.
Yeah.
Yeah.
Yep. One of the things that I think as I've grown as a physical therapist, this is something that the awareness has really heightened, and it's something that it never even occurred to me to ask particularly my athlete clients whether they were having. If you ask somebody if they have pelvic floor issues, they're going to go, I don't know what that is. Yeah. But like stress incontinence. So if somebody is peeing their pants, doing something where they're, or exertional incontinence would be the other one, where you're lifting something and you have leakage, that is, first of all, it's not normal.
Yeah.
And it's something that it never even occurred to me to ask.
Yeah.
And so it's something that and I have conversations with all of the therapists now about the importance of making this a question on intake. Whether you're a runner, cyclist, CrossFitter, whatever, making sure that this is something, that people, and that's also one of the benefits of having sort of a room that we're doing therapy in versus a big open treatment area where you can ask these kinds of questions and hopefully get an honest answer. Because it is, I think that it's gotten to the point now where people are having enough discussions about it that people sort of are aware that it's happening maybe to other people, but not, maybe they're like, well, I've had a couple kids and like this is just normal, and it's like, no, it's actually never normal.
Yeah.
And it's not, it's just, there's some pretty simple solutions to it, but people are not talking about it or just not aware.
Yeah. I first heard about it, I was following K-Star's mobility project, and episode 200 or 260, he was like, it is not okay to pee your pants when doing double unders. And I was like, this is a thing? And he was talking about how in their gym, there was a few women who would just do double unders, and they'd have some towels, and they'd just clean up, and that's just what it did.
Yeah.
And the whole concept that that's not a normal thing, I mean, I wasn't even aware that was a thing.
Right.
And then when we started the gym, occasionally it comes up like, hey, this is happening, is this normal, is this... Yeah. And the answer is no. Yeah. But also, like, I don't know, outside of go see a physical therapist, I don't know what to do with that.
Yeah.
And so part of what I wanted to do with this conversation and with this workshop we're doing in February is learn what the symptoms are of, like, wow, you see a physical therapist, definitely see a physical therapist, and then what are things that people can incorporate into daily, weekly routines to sort of stay ahead of the curve and prevent. And then obviously how childbirth and how all that affects it and how that changes things. And then the pelvic floor in men is also something that I'm super interested in. But before we dive into all the specifics, what is the pelvic floor?
The pelvic floor can be thought of like a bowl. So basically it's like a dish that kind of holds everything else. It's basically the bottom lining to your pelvis, and it can be thought of in layers. It is something that can be treated externally some, internally some, like an intravaginal treatment would be somebody who, would potentially need that. Yeah. but there's also like engagement of the abdominal muscles, for example, will sort of help engage the pelvic floor muscles, and then things like kegels, for example, is a term that people know, but they sort of, I think everyone sort of understands that it's the sensation of like if you were peeing and you would try to stop the flow, that is what a kegel feels like, but a normal strength for the pelvic floor would be able to hold that for 30 seconds. And a lot of people can't do that. Like,
interesting.
A lot of people can't, even if they can accomplish a kegel, it's like just a momentary contraction of the muscle, and then they can't hold it.
Okay, so it's the musculature that makes up the base of our pelvis.
Yes.
Loosely.
Thanks for boiling that down.
It's simple. Let's keep things simple. It's been a while since I took anatomy. So the muscles on the bottom part of the body.
Right.
All right.
So, so any leakage, any incontinence is not normal.
Right.
And and that can happen for a number of different reasons. So in terms of like muscles in general, muscles can have a couple of different manifestations of issues. So if you feel like you're weak in any muscle, weakness sometimes isn't always what it appears. So if you're having an issue with, whatever, a bicep curl, something real basic. If you're having an issue with a bicep curl, let's say one is much easier than the other, and you go, oh, I'm weak on this side, so I'm going to do a bunch of bicep curls on this one to get strong, and it just isn't going anywhere. Oftentimes it's because the muscle is tight. So when you have tightness in a muscle, it's contracted. So it's like a knot in the muscle, and you can think of it like a knot in a rope. So you have basically the rope, if it should be, a foot long, and it's only 3/4 of a foot long because of that knot, it has less capacity. So when you're trying to ask it to activate, it can't work properly because it's got this knot in it.
Okay, and so you said the knot is a contraction.
Right.
So
like an involuntary contraction within the muscle.
Okay, so my bicep,
Yep.
ton of muscle fiber. I mean, we're talking,
Yep.
my bicep is huge. one of the biggest.
Massive. Yep.
So there might be a few muscle fibers or
Yep.
some muscle within the bicep that is contracted.
Yes.
And it's that contraction that
Shortens the muscle.
shortens the muscle and creates the knot.
Right.
And so when we do in the gym, when we do foam rolling, lacrosse ball work, the VooDoo floss stuff,
Yep.
all of that is to release the contraction.
Yes.
And by releasing the contraction, we're breaking through the knot.
Right. And it allows the muscle to work properly.
Got
So if you, so again, using a bicep curl as an example, your strongest part of the bicep curl is in the mid-range. So you're not doing bicep curls with your elbows straight, and you're not doing them with them fully bent. The strongest part of that is the middle part of that arc.
Okay.
If your muscle is already shortened because of a knot, then it changes that arc. So like if you have a knot, you can't ever fully lengthen the muscle. It's going to change the strength, and it's going to appear weak.
Got it. Could you also, so it's gonna because it's shorter.
Yep.
That's one factor. Could you also
Yep.
think of it like, is this a different thing, or is this a different way to think about it? Since that muscle, there's, let's say my bicep is 100% and then 20% of it is contracted, is knotted.
Yeah.
So I'm only curling with 80% of my
Right.
overall potential.
Yeah.
So is it kind of both things, or is that just two ways to look at the same thing? I don't know if that makes any sense.
I think it's both.
Okay. Where it's a little shorter, and so there's a mechanical disadvantage because it's
Yes.
shorter. It's shorter
Yes.
because it's contracted.
Right.
And since it's contracted, it's not contributing to the effort of the rest of the
Correct.
muscles in
That's
the body.
right. That's right. So, but it is not truly weak. It
Right.
just appears weak.
Right.
So if you go, you do your VooDoo bands, you do your mobility, you stretch it, whatever, and suddenly you feel much stronger, it's not because it was ever weak, it's because it was tight.
Okay.
So if applying that logic, but then on the other hand, it could also be weak. Maybe you haven't used it, or maybe you've been doing a unilateral activity or whatever. So
Right.
like there's the two things, the two options. If you apply that to the pelvic floor, you can have leakage because things are too tight and the muscles can't work properly,
Interesting.
or you can have leakage because things are weak and not engaging properly.
Okay.
So, and that's where something like physical therapy would come in to make that assessment. Is it weak or is it tight?
Okay.
And what's causing the dysfunction?
Got it. Now, is there anything to, I mean, the concept of like bicep, tricep,
Yes.
extension and flexion.
Yep.
Where is it possible to, you know, overtrain your bicep and then have underdeveloped triceps and have the strength of the bicep create problems with the elbow because there's not balance? Is that a thing?
Yeah, it's a little different just because the muscles are shaped differently and they're, you know, placed a little bit differently, so you don't have that direct sort of agonist-antagonist
Okay.
relationship like you do with, say, a bicep and a tricep. But you still, the muscle principle of the muscle has to fully relax in order to engage when it's needed the next time still applies.
Okay.
So again, it sort of goes back to that tightness versus weakness
Okay.
discussion. So it's the muscles have to relax in order to engage properly, and in the agonist-antagonist relationship, if you're contracting your bicep, the tricep has to be relaxed.
Got it.
And if the tricep is tight or not relaxed, then you will get a artificial, again, weakness of the bicep.
Got it. So if I have a lot of knots in my tricep,
Yep.
or if my tricep's super weak,
Yep.
then it'll affect my biceps.
Right.
That makes sense.
So, and the same can be true. It's a slightly different relationship, but the pelvic floor has similar sorts of muscles. So like if your abs are really strong, but your pelvic floor is really weak, then the incontinence issue is going to be worse because you're contracting something around it that's going to push on it and cause more problems.
Got it.
So if you're sort of overtraining in the external muscles, glutes, abs, things like that, and not working on your pelvic floor also, that is an imbalance.
Right, right. So the same way that you want to develop strength, you know, for, you know, functional strength in harmony, you don't want to do a ton of pull-ups and never do dips.
Right.
You want to be aware of that balance and that harmony in the pelvic floor as well.
Right.
That makes sense.
I think how to do that is probably another conversation. This is
For sure.
More in-depth thing, and maybe come to the workshop.
Yeah. So, all right, I get what the pelvic floor is there for and where it is and what it is. Let's jump to a few symptoms that we've been talking a lot about incontinence. Okay, so
Yeah.
if some pee comes out when you're jumping,
Yep.
if you sneeze and some pee comes out, if
Yep.
you contract your abs and that causes you to pee,
Yep.
so any type of incontinence like that,
Not normal.
not normal.
Yep.
See a physical therapist,
Yeah.
right?
Yeah.
Okay,
It's probably the easiest way, and sometimes it's only a session or two.
right.
You get some tips and tricks, and you're like, I get it.
Right.
And maybe your pelvic floor is just weak, and you aren't even really sure how to engage it.
Right.
You've learned the tricks to engage it, like, you know, there are some specific techniques, and then you're like, I get it, I'm fine.
Right.
Now I understand what a Kegel actually is. Okay, I can do
Right.
those.
Okay. So, and we've been talking, I've only really seen the incontinence issue in women. Maybe it's happening in men and they're just not saying anything, but pelvic floor in men, is it the same? Does it present the same way?
Sometimes it can also present with things like erectile dysfunction, which is another thing that, again, is like people don't want to talk about it. and men have their own version of a Kegel and a pelvic floor contraction that will allow to strengthen. But again, it's assessing whether is it tight or is it weak.
Okay.
And figuring that out is where a professional will come in.
Right. So, men, if you're peeing yourself, erectile dysfunction, maybe it's a pelvic floor issue. Could be other things.
Yep.
Women, if you're peeing when you're jumping, sneezing, that sort of thing,
Yeah.
probably a pelvic floor issue.
Probably.
So see a physical therapist for that. So that's kind of the symptom world of things. But for people who aren't quite there yet, what are things that we can be doing in the gym? What are things that we can be doing just at home as part of our daily maintenance routines to create that strength and release the tension, I guess? Is that the right way to think about it?
Yeah.
Strengthen and release the knots?
Sure. I feel like, so in general, in terms of pelvic floor health, the easiest and simplest thing is kegels.
And that's just the stop your pee.
Yep, kind of contraction, but you should be able to do that without needing to, like, you shouldn't need the sensation of urination to accomplish that.
Right.
So you should be able to do it without actually needing to pee at the same time in order to feel it.
Okay.
You should be able to hold it for 30 seconds.
Okay.
So the goal, even if you can't get there, the goal is 30 seconds.
So we should be doing kegels two
Few
times
times a
every
day.
day?
Yeah.
So like sets of 10, 3 sets of 10, is there,
No, probably like at 30 seconds, probably like a set of 3.
Okay.
Like it doesn't need to be a ton, but enough. And then, so then if you're having issues doing, so let's say one day you're like, I can't get to 30 seconds today. Then that's an indicator that something is going on. Just like you would want to check your mobility before you went and did something extreme in the gym, you would want to check and make sure that you're feeling loose and limber that day before you went and tried it. And if you're, you get on the foam roller and something's really tight, you're like, maybe I'm not going to go do that extreme whatever, and I'm just going to work on mobility today.
Okay.
And so, same kind of thing with pelvic floor. So like, let's say you can't get to 30 seconds one day, and you're like,
Right.
I wonder if something's a little tight or something's a little off. Like, maybe that's not a day to do some heavy lifting. Maybe that's a day to do more mobility, more stretching, more focus on that pelvic floor.
Okay. So what are some stretching mobility? What are some things that you can do that feed into the pelvic floor? That could be things that we can do in the gym, things that people can do at home. Like just some ideas to start to get people thinking about stretching different parts of their body.
The one of the muscles that I find most commonly neglected is the adductors.
Wow, that comes up a lot with you.
So adductors, which is your inner thigh muscles, the inner thigh muscles are something that I find people, they do everything else. They do quads and IT bands and glutes and hamstrings, and they know that the adductors are there, but like don't have any, they never think about stretching them.
Yeah.
So your adductors are not directly connected to your pelvic floor, but they attach at your pubic symphysis, which is right next door basically. And if you have tightness in your adductors, it's an agonist relationship where muscles all sort of work together to accomplish things. Adductors are something that I think are generally neglected, and something that are really easy to address.
Okay.
So that's a really good one. Kegels and adductors.
Foam roller inside of the quads or inside of the legs.
Yep.
Kind of from the knee all the way up. Get as high as you can.
Yep.
Lacrosse ball stuff. The VooDoo floss around the legs is going to definitely hit the adductors.
Yep.
All good things to.
Well, they are if you're doing ab and adduction. So if you're just doing flexion extension with your knee and you're doing VooDoo bands, you're gonna get your quads and your hamstrings really well.
You're about to blow my mind. All right. Bring it.
But if you're not, so if you're flexing and extending your knee, you're getting the muscles on the top and the bottom. To get the muscles on the sides, you have to go in and out.
So we're talking like the fire hydrant stuff laying on the ground.
Yes.
Oh my goodness, I've been doing it wrong all these years. I just assumed that if you wrapped it, it was getting it done.
Yeah.
Oh man, all right.
Because, so if you think about what's lengthening and shortening when you flex and extend your knee versus what's lengthening and extending when you're going in and out with your leg.
Yeah, it seems so obvious, but this is...
It's okay. That's why we're the mechanic.
This is why you have a clinic and I have a gym.
Yeah, well, no. It's just a different thing.
Now I'm racing through my mind, seeing all the things that we because we VooDoo floss a lot for elbows, biceps, shoulders, obviously like knees, legs. We lean on the VooDoo floss a lot, and I'm just kind of flashing through all the things that we're doing, and I'm thinking of all the planes that we're missing, and so that's really, really insightful.
There are 3 planes.
Okay. So flexion, extension, ab and adduction.
Basically flexion, right, leaning forward,
Yep.
and then side to side,
Oh yeah.
and then rotation.
Okay. All right. That makes
Okay,
sense.
so I know that you've heard this from me before, but I'm gonna for our audience, I'll go through it
Yes.
again. Your body is made of an alternating series of stable and mobile joints.
Yes. And this, when you introduced this concept, it blew my mind. So listen up. If you're doing dishes, if you're just this is super important. This is amazing.
So your toes are stable joints. It's a series of joints. There's a whole bunch of them in there. Your toes basically move in one plane of movement, and that is flexion extension. They do other things, like they move side to side a little bit, but their main function is flexion extension. So you can like toe off when you're walking and things like that. Your ankle is a mobile joint, so it doesn't just go up and down, it goes side to side and it goes around. So it has 3 planes of movement. Your knee is a stable joint. It moves basically, it does one thing, it does flexion extension. Your hip is a mobile joint. It doesn't just go up and down, it goes out to the side and around. So it moves in 3 planes of movement. It's a mobile joint. Your lumbar spine, your low back is stable. It moves flexion extension. Your thoracic spine is mobile. It does it's supposed to do all 3 things. Your low neck is stable, again, flexion extension. Your upper neck is mobile. So if you think about the movement of your head, the rotation of your head, most of it comes from the very top.
Yeah. Interesting.
Not
Yeah.
lower in your neck. So like
Right.
all the, the real like cocking your head or like looking to the side or all those things really come from your upper neck. It's a
Right.
mobile joint. Your shoulder is a mobile joint. Your elbow is a stable joint. Your wrist is a mobile joint. Your fingers are stable joints.
Yeah.
So when you you have this alternating thing that goes all the way from head to toe.
Right.
If you take a mobile joint and you stabilize it, so like your hips are mobile, your thoracic spine is mobile, your ankles are mobile, if you tighten it up with, I don't know, injury, surgery, sitting at a desk all day, whatever these things are that cause tightness in our mobile parts, if when you take away one of the mobile parts, it puts stress everywhere else in the system. Your mobile parts are essentially your shock absorbers.
Right.
So if you think of a vehicle and you take away a shock absorber, something else is going to break because you've stabilized something, and then that impact goes somewhere else in the body.
And I think you see this a lot in sports.
Yes.
Where you wrap the ankles super tight.
Yeah.
And now you tear your ACL.
Right. That's a perfect example.
That makes sense.
The thing that we see most is people who have tightness in their upper backs because they have desk jobs.
Right.
And we sit and play on our phones, and we sit at computers, and we do all this slouching. And,
Yep.
Yeah, that's right.
Posture's better.
That's right. And that mobile part of your mid back that's supposed to be mobile becomes stable, and then you have issues in your neck or your low back, typically. So
Right.
whatever the mobile part is, the stress usually goes either above or below.
And so is it fair to think of it also like this, where if you're looking at, kind of a joint by joint assessment of the way somebody moves, mobile joints, you want to do mobility on.
Yep.
Stable joints, you want to do strength and stability
Yes.
on.
Yes.
And so if I'm working with somebody's squat and they have a really immature squat, not like super shallow, they're not getting full depth, we're working on the hip, we're stretching, we're foam rolling,
Yeah.
lacrosse
the
ball
ankles.
work and the ankles, yeah.
Yeah.
But the knee, there's not much stretching that happens there. A lot of it is the abductor, adductor strengthening
Yeah.
of the complex.
Yes.
So when people say, like, there's a debate going on in a lot of the CrossFit circles, this idea of like stretching versus movement and strengthening through movement. I mean, sounds like both camps are right. We're just
Yes.
talking about what joint.
Yes.
Oh, yes.
Yeah.
The unified theory of mobility. That's awesome.
Yeah, they are equally important, and you cannot do one without the other.
Right.
You just can't.
Right. So we should be strengthening and we should be mobilizing, and it just focus on the different types of joints and playing into the joint strength.
Yeah.
Okay, cool. All right, so back to the pelvic floor.
Sure.
We're doing kegels.
Yep.
Kegels? It's
I don't
either
know.
kegels. We're calling them kegels. Adductors.
Yep.
All right. Anything else?
So adductor stretching, but back to your other point, adductor strengthening. It's
Right.
also sort of a neglected thing. We spend a ton of time on glutes and hip abductors because they're really important stabilizers, and quads and hamstrings and whatever, but doing adductor strengthening, so even just a simple squeezing your knees together, like sitting, squeezing your knees together, just that in and of itself can sometimes, like if you're having trouble activating your pelvic floor, it will help. It's a agonist, will help influence the contraction of the pelvic floor.
Okay.
So if you're having trouble with that, that's one way to sort of do it. You can squeeze your knees together and sort of squeeze your pelvic floor at the same time.
So if I put like a yoga block between my knees, hold the yoga
Sure.
block, do glute bridges maybe? Or is that...
Well, it's not wrong, but you would want to spend some time, and one of the sort of things that's sort of a finesse, I guess, about the pelvic floor is that it's important to be able to isolate. So yes, you can do that, but then you're engaging glutes, adductors, trying to get your pelvic floor, abs, all that stuff all at the same time.
Okay.
I think that particularly for the beginner, you would want to try to separate that.
Okay.
So like when you're sitting, squeezing your knees together, sure, you can use yoga block or not.
Right.
Squeezing your knees together and trying to do that without squeezing your glutes at the same time.
Interesting.
So,
okay.
and then try and do it with squeezing your glutes. Like try to isolate the different muscle groups so that you can really feel the different contractions in the different places.
That makes sense. And if someone gets pretty strong at just the contraction, is there some sort of resistance, like a low resistance band that you could put around and start doing some strengthening stuff in that way?
You could also just use gravity. So like lay on your side.
Yeah. Or get one of those Jane Fonda leg things.
Right.
Yeah. Everything's coming back.
What is it? The Thigh Master.
The Thigh Master.
The Thigh Master, yep.
Yeah.
No, that's Suzanne Summers.
Suzanne Summers?
Yeah.
Okay. The Thigh Master. It should be called the Abductor Master.
Adductor.
Adductor. Oh, that's right. Abduction is to take away, adduction bring together.
Yes.
Right. Kids get abducted.
Right.
They rarely get adducted.
Right.
Okay. Got it.
Hopefully they get adducted later.
Yeah.
Eventually.
Right. Yeah.
Yeah.
Right. So it should be the adductor
Yes.
machine.
Right.
Or master. Adductor master.
Right.
Cool. All right. So we're gonna mobilize our adductors. We're gonna strengthen our adductors. We're gonna get a thigh master for the gym.
Yep.
And okay, so that feeds in. What else?
Isolating glute contractions.
Okay.
So again, even just sitting or laying down, however you want to do it, but not so like don't do a Superman. Like that's everything.
Yep.
And what that's going to do is activate your posterior chain, but it's really easy to leave out your pelvic floor when you do
Right.
that.
So a Superman laying on your stomach, just sort of arching up.
Yeah.
Sort of like a reverse hollow hold.
Right.
Okay.
Would be a way to activate your posterior chain, but not necessarily
Right.
a good way to activate your pelvic floor. So it's isolating. It's really, I think, picking apart the different muscle groups and getting in tune with your body. I think a lot of pelvic floor issues, I guess this is sort of has led me to this, but this conversation has brought me to this, but I think the reason why a lot of people have issues with the pelvic floor is because they're just not in tune with that muscle group.
Yeah.
And that happens with athletes in all parts of the body where you're like, oh, I'm always doing bicep curls and I'm never doing tricep curls.
Right.
Or whatever, dips or, whatever, however you accomplish activating the tricep. So you create these imbalances.
Yeah.
And so the imbalance that is potentially created by doing the Superman is you're getting the posterior chain, but you're never really getting the core.
Yep. Yep. That makes sense. So a way to isolate the glute without anything else. Let me think about this one. Is that sort of standing and doing like leg extension?
No. You would want to do it like sedentary.
Okay.
This is not and it's less about strength. It's more about making sure that the muscle can activate properly independently.
Got it.
And it's less about like Superman would be like a strengthening activity.
Right. Yeah, for sure.
But I think the key to the pelvic floor is really being able to hone in on that muscle group without activating everything else.
Right.
And because that gets too confusing.
Yeah, and you're just masking, like, your abs can mask whatever,
Right.
A more important muscle that should be firing. That's not firing. You're providing coverage, your body's great at getting the job done. It's less great at getting the job done as efficiently and effectively as possible. And that's kind of how the body starts to break down.
Right.
And so learning how to isolate each of these muscle groups, or learning how to contract each of these muscle groups in isolation, then you start to create the motor pattern to create that contraction in a more complicated movement.
Yes, exactly. Wow. Couldn't have said it better myself.
I think you did say it better yourself. I just dumped it down for for my understanding. Okay. So
all of those things, even something like the hip flexors, which is really hard to separate the hip flexors from the quads, but really doing like a very, whether it's sitting, whether it's laying down, whether it's in a laying down position with your knee, with your hip at 90 degrees and doing like a pressure on a resistance, just a hand resistance on your knee, to again start to separate some of these muscle groups. What does it feel like when your hip flexor is activating versus your quad? What does it feel like when your hip flexor is activating versus your pelvic floor? What does that feel like compared to activating your glute? And being able to activate all these different things separately so that the whole can work in unison better.
Yeah.
I think that body awareness is something that it leads to injury. I mean, it just is something that people don't spend the time to do, and they want to go do their lifting or whatever they want to do. And they're always thinking in terms of the whole, and you really have to break it down. Yeah.
Man, this is awesome. I'm envisioning this video game where you hook your you hook your body up with all these different sensors, and it's like Guitar Hero, and it's like activate this, and you're like ding, and then you hit it.
So we actually have that.
What?
Yeah.
No way.
We do.
This exists?
It sort of exists. Yep. So the surface electromyography is essentially electrodes that you put on the body and measures muscle contractions.
Really?
We have that here at Rose PT.
Wow.
Ironically enough. And
someone's got to connect that to Guitar Hero. That would be amazing.
The software does have some like games and stuff you can play, but I always just look at the line graph. I'm boring.
Right.
But the one that we have can look at 4 muscles at a time, and show it literally is like a line graph where you're like, oh, that's activating, the line goes up. When it's relaxed, the line goes to flat. And so it is something that we do use from time to time. Mostly we use it on people who have chronic shoulder issues, who are tensing their shoulders all the time and don't know that they're doing it. It's like a body awareness thing.
So that will pick up, like if someone has a knot, that's a constant contraction. Is that different?
That's different.
Because that's small. That's
yeah, and it's also not the same. The physiology of it is different than an active contraction.
Okay.
Well, that's a topic for another day.
Yeah. So there's active and inactive contractions.
Yes.
Is what you're telling me.
Yeah.
Man,
yeah.
All right. Got a lot to learn here, guys.
Yeah.
Okay. Any other type of exercise for the preventative side of things? Just learning how to contract in isolation all of the muscles that kind of feed into the pelvic floor.
Yep. So, doing some activation activities, not necessarily strengthening, and then doing isolated strengthening stuff, which is stuff you're probably already doing in the gym anyway, but also understanding all the muscle groups that are at play. So, don't just do a squat, like think about all the parts that you need to accomplish that squat, which it sounds like you
spend a lot of time teaching the bracing sequence.
Yeah.
And I'm more than open to your input on sort of the way that we generally teach bracing. So we sort of have people set their pelvis by either squeezing their butt, screwing their feet in the ground, creating external rotation, sets their pelvis, abs tight, but we try to like tighten through the bottom, if that makes sense, and then sort of like
pull up,
right?
Yeah.
And the way that I think about it and teach often is, if you're trying to exhale kind of your abs to your spine, it creates deep tension.
Yeah.
And then I create tension kind of through a breath through the top. And now your spine is set. And so now you can't create hip flexion if your butt is squeezed. So we try to maintain hip tension through the external rotation in the floor through our feet. And then obviously the abs stay on, which hold the pelvis in place. And then we move, whether it's deadlift or squat. And so that's generally the the midline stabilization techniques that we teach.
Yeah.
A plus, B plus.
No, it's all good. The part that I think is really hard to incorporate is the pelvic floor, and it's really important. So when you do sort of set your abdominals and pull in and pull up, it pushes down on the pelvic floor.
Right.
So it creates this stress. So like if you even just like hold your breath, that Valsalva maneuver, which is what that's called, it puts pressure on the pelvic floor, and if it's not activated, it will create a system that will allow something like incontinence.
Okay.
So when you do that, but it's a really hard thing to cue.
Got
it's
it.
like I wouldn't even without having the privacy of like a therapy session.
Yeah.
Let me think about that a little.
Yeah, sure. Come to the workshop. But is that, I mean, is activating the pelvic floor, is that the Kegel?
Well, it's certainly, yes.
So an easy cue. So you would also want to stop peeing. That would be the other cue. So activate the pelvic floor by stopping the pee.
Yep.
And then go through the ab.
Yes.
And so every time we squat, we should be clenching the pee muscle.
Yes.
That's easy.
Yeah.
We can do that.
Totally easy.
That's done.
Yeah.
Skip the workshop.
Yeah.
Okay. No, that's super helpful. Because I never thought about it in that regard. I just assumed that if you set the pelvis, squeeze the abs, that pulls the pelvic floor in place. But the idea that the pelvic floor is still open and now you're pushing down on it. And that would explain a lot of the incontinence issues where people are stabilizing from their abs when they're jumping rope or whatever, but it's not stable underneath.
Underneath, exactly.
Okay.
It's the floor.
Pelvic floor, man.
Yeah, it's the floor.
Super important.
If you don't have a floor, you're gonna fall right through.
It's insane because you'd think that it would just naturally be one of the strongest parts because it's literally the bottom, you know.
Yeah.
It's interesting how. So what do you think is the cause of a lot of that dysfunction? When we see people move in the gym, we see the immature squats, we see the hunched over. It's obvious, you know, the sedentary lifestyle that we've, you know, the 9-to-5 desk, sitting a lot is kind of the cause. And so that's one thing that we're constantly fighting. Let's get standing desks, let's walk, let's teach posture, let's do stretching to, you know, reverse the effects of all of that. What's the deal with the pelvic floor? Is it the same sort of stuff? We sit all day and same thing?
Yeah.
That makes sense.
Yeah, I mean, if we were out like riding horses and like, you know, running more and like active, it would be a lot less of a problem.
Okay. So the more of the preventative ideas for pelvic floor health are just the same thing that we're kind of preaching all day, every day, right?
Yeah.
Be more active,
Yeah.
be less sedentary, stand more, do walking meetings, take your phone calls, you know.
And I think in our world, the culture that we are in now, it's so easy to live disconnected from our bodies because we are playing on our phones and we're watching TV and we're doing things that disconnect us from our own physical being. And at the risk of sounding like totally frou-frou, that is something that we need more of, is like mind-body connection.
Yeah.
And the pelvic floor is something that is like really neglected because it's also in our culture, it's like not something people want to talk about. It's like not something people want to address. It's embarrassing. It's whatever. And so it really gets left behind.
Yeah, no, that makes a lot of sense. We have these soft kind of balls that we lay on our stomachs and we sort of stretch out the abs and then the psoas that go through and kind of roll them around and then kind of push them to the top of the pelvis. Yeah. Is that doing anything for pelvic floor health, like releasing ab tension, or is that just kind of?
It certainly helps. Like you know, that relationship where if you have something that's tight, it's going to affect something else. So it's always good to keep everything balanced. For sure.
Lacrosse ball work and the glutes.
Yep. All of it.
All good.
All of it.
Now I saw something on YouTube with these. They're not quite lacrosse balls. Think more like tennis ball, but just kind of sitting on it.
Yeah.
And the muscles kind of in the middle.
Yep.
Is that a thing?
Yeah. Potentially, it's one way to sort of get to your pelvic floor, I guess. It's there are internal tools and there are external tools, but again, it's figuring out whether is it tight or is it weak.
Right.
And so making that determination and figuring it out. I mean, if something's really painful and tender, you can bet that it's tight.
Tight, yeah.
And if something is you just like, I didn't even know that was a thing, that it's probably weak.
Yeah. Well, and the video that I saw that was talking about that was this idea that, you know, kegels all day, every day isn't necessarily the solution.
Right, exactly. Because
that's like doing a million bicep curls and never doing...
Exactly. It can lead to over-tightening.
Okay.
Yeah.
And so they were presenting that, you know, the loosening component would be putting the ball down there and just rolling out, sitting on it at work or whatever.
Yep.
That might be a little weird, but
well, I mean, you know,
wherever you got to get it in.
Yeah.
All right, that's really helpful. I'm trying to think if I have any more questions. This is
the one thing that I will add is, you know, you mentioned postpartum.
Oh yeah.
And pregnancy, which puts a lot of pressure on the pelvic floor, and then of course stretches it all out.
Yeah.
And so you go from something that's supposed to be, you know, not having a head shoved through it, and shoving a head through it.
Right.
It is supposed to have a head shoved through it, but you know.
Right.
And then our sedentary lives don't necessarily lead to it sort of springing back to where it's supposed to be, relatively quickly. And so it's another factor of things that I think that a lot of moms are like, well, I've had kids, like of course I have urinary incontinence. It's like, no.
So that's still not
a thing. It's
right.
not a thing.
And would a postpartum situation, I mean, obviously not like immediately postpartum, but, you know, 3 months removed from pregnant or from, you know, having the child, would that prescription for that woman be the same as, you know, all the stuff that we've kind of been talking about?
Activation, isolation, yep.
So that's good.
Yeah.
And then same thing for men, right? It's the same conversation.
Yeah.
It's the kegels, it's all the muscles that come in, learning how to contract them properly
and separately.
Right? This has been mind blowing. This is really cool. So if you're listening to this before February 10th, then come to the workshop. Is 1 or 1:30? What do we say? I think 1:30, 1 o'clock. Anyway, 1 or 1:30. We'll have a sign up link on all the social media stuff. It's a free workshop. I don't think we're capping it to a set number of people.
It's however many people you can accommodate.
Yeah, so show up, and it's going to be
1:30.
1:30 to 3:30.
Yep.
Saturday, February 10th at 1007 H Street, and yeah, so you're hosting it. Rose
Yep.
Physical Therapy. Is your pelvic floor expert going to be there? Or is it us?
It's going to be me.
That's what I'm talking about.
Yep.
The pelvic floor expert.
And we have and a couple other people will be coming to assist.
Okay, cool.
Me leaving.
Awesome. And then for this workshop, we're going to go through, I would imagine, a lot of these isolation contraction exercises and learning how to feel what muscles to fire and how to fire them, and a lot of stuff that just, it's hard to describe through a podcast.
Yeah. Yeah.
But
I'll bring some models and some drawings and some pictures, and we can, it's easier to visualize.
Yeah. And honestly, I think we accomplished my biggest goal with this podcast is just to figure out what the intervention points are for people to get to a physical therapist. Because oftentimes it's easy when we're talking about shoulders or knees, it hurts, or this, I have nerve pain and, it hurts when I do this. But a lot of times we don't know when it becomes an issue. And so any sign of incontinence during normal activity, we're going to the physical therapist. And then for men, incontinence, and then the other thing.
See, things we don't like to talk
That's
about.
That's right. Erectile dysfunction.
Yep.
And we're going to see a physical therapist for that. But then in the gym, we're going to work on all the things that we worked on. And I'm really excited we're having a lot of coaches come to this, and I'm excited to incorporate some of these isolation exercises into our warm-ups. And that's what we've been trying to do a lot of in the gym, is sort of using the warm-up portion as a little bit of prehab and learning how to activate, and then doing a lot of the stretching, recovery, mobility work after the workout.
Yeah.
And it's been working out pretty well for us.
Awesome.
Sweet. Well, if you need physical therapy, check out check out Rose Physical Therapy, and yeah, I think that's all we have.
Thanks.
Thanks, Claire. This is awesome. High five. Sweet. Thought that was perfect.
Yeah.